Thank you, sir. Mr. President, in 1984, President Ronald Reagan designated October as the National Down Syndrome Awareness Month. And we've been honoring that day, that month, ever since. We are attempting to ensure that Americans have had the opportunity to celebrate and recognize individuals with Down syndrome and those individuals' contribution to our world. Since 2015, I've served as the co-chair of the Congressional Down Syndrome Task Force, a bipartisan, bicameral caucus dedicated to promoting policies that enhance the quality of life for individuals with Down syndrome. Last September, the task force partnered with leaders in Down syndrome advocacy groups and the medical research sector to host a roundtable discussion on recent scientific advances in Down syndrome research. During the roundtable, self-advocates brought awareness to the issues important to their communities, such as work and education opportunities, policies to improve independent living, support for their loved ones, and caretakers and medical research. Hearing the firsthand testimonies from individuals with Down syndrome and medical professionals who've dedicated their careers to the understanding of Down syndrome in order to better care for the community was meaningful to me, and it helped us better understand the needs of the Down syndrome community. Through my interactions on the task force, I have also had the privilege to meet amazing parents, siblings, aunts, uncles, advocates, and caregivers who support individuals with Down syndrome in living successful and fulfilling lives. The dedication to improving the lives of those in the Down syndrome community is appreciated not only this month of October, but in every month, every day, every year. As a co-chair of the task force, I've worked to advocate for federal resources for Down syndrome community to support medical research and enable individuals with Down syndrome to live a full and independent life. Through congressional commitment to expand federal resources, Down syndrome research has improved significantly in recent years. In May of 2022, the National Institute of Health report stated federal investment in Down syndrome research had increased from $18 million in fiscal year 2014 to around $124 million in fiscal year 2022. This increase in funding is a recognition of the gaps in our medical research and working to make certain that we prioritize learning more about Down syndrome. As we take this month to celebrate Down syndrome, the community, and their families, I look forward to building on recent successes and urge Congress to renew its commitment to pursuing policies that support Down syndrome communities and improving the quality of every American's life. Mr. President, I yield the floor.